hearing, at minimum the foam earplugs. You can do the earmuffs that have like the radio on them, but don't be putting, my mom used to be putting in her like iPod and like cranking it up and without ear protection. I'm like, oh my God. I'm like, you already have hearing loss and you're making it worse. So don't do that. If you want to listen to music, at least put on your earbuds and then put them off over the top. So yeah, lawnmowers, chainsaws, leaf blowers, outdoor concerts, like unless you're going to be far away or you go to the fair and you hear those concerts, put on a pair of earplugs. They're loud enough, you're going to hear the music just fine, but you're going to damage your hearing if you don't. Questions for Alana? At school, courses, anything?
College? No?
Any random questions that have nothing to do with audiology you're just curious about? I'm an open book.
I have a question for Alana.
Yeah.
So what's next for you now that you're finishing up with her?
Yeah, good question. So in our program, we have like 3 clinical placements. So it's kind of like we get a little taste of like different, as she was talking about, like all the different avenues that you can do. So over the summer, I was at a children's hospital in Minneapolis, which is where I'm from. And then right now I'm with Dr. Sigmund. Today's my last day. So at this ENT practice, so more medical. And then next semester, I will be in a school. So actually like in a high school, middle school, and elementary schools, going around because the kids that have the cochlear implants, the hearing aids, the bone-anchored implants, those kids really struggle in classrooms. And so it will, in the future, then be my job to go in there and, you know, to help them be able to, like, listen and kind of block you guys out, you know, so that they can hear what the teacher is saying and communicate better. And then, as she mentioned, in, like, at the end of the program, you have, like, that 1-year unpaid internship. Yeah. So I will be doing that at the University of Minnesota at the Children's Hospital, again, where I was this summer, because I love kids. I'm all about it. I don't really do old people. But she does. She likes them. We all have different hearts, you know, and different, like, skill sets. So I just challenge you guys to really think about that, because that's what's going to sustain you and make you, like, enjoy what you're doing. Yeah. Good question.
So are you guys juniors, seniors, sophomores? Where are you guys in your juniors, seniors? What are you guys kind of thinking? What are some of the majors you guys are? Psychology? Cool.
And it's cool if you don't know. You're going to fail a class. It's bound to happen. And then you're going to have to, like, find a new path. Be open. Okay, cool.
Anything else? Does grad school scare anybody? Oh, sorry.
I was just going to ask, most of you have any patients that like particularly stuck out to you, like that,
Oh, yeah, you can say your story.
I don't know if it's funny. Okay. So when I was with Dr. Sigmund a couple of weeks ago, this woman, we were like talking, having a great appointment, and then all of a sudden she comes up to me and she's like, I need to give you this. And I was like, what? Like, oh no, like I must have left like something dirty on the floor, like, oh, how embarrassing. And she gave me her earrings. She like took them out of her ears and she's like, I want you to have these. I was like, oh, okay, like, thanks. And she's like, it's not weird. I do it all the time, especially with high schoolers. Like, I just take out my earrings and give them to people. I was like, that was a first, but I wore them on Thanksgiving. So they are actually super cute.
Cute, but super.
Yeah, it was, and they were cleaned. Okay.
Yeah.
Funny, sad, dealing with elderly, I mean, I see a lot of, I lose a lot of people. Not on my watch, thankfully, but, you know, so that's kind of the one nice thing about being an audiologist is you do really develop patient-provider relationships. So if you're like going to medicine and you're working hospital inpatient, your patients come and go pretty rapidly overall unless you're doing like rehab or something. But for us, we get to know, watch the kids if I fit them. I watch them, you know, go up and I'll say, holy cow, how are you in middle school? you know, or we talk about their kids or their jobs or where they, you know, winter in Arizona. So you develop relationships. And I have a lot of patients on my caseload right now that are upper 90s, and you do lose them, you know, which is sad. You know, but that's, luckily I'm not providing life or death intervention. Because I would have a hard time with that. I get too emotionally attached. But if you're somebody that likes to develop kind of those more connections, this might be a really good option too, because you really do get to know not only just the patient, but the spouse, the kids, grandkids, yeah.
Would it be helpful in your profession to know sign language, given that you work with deaf people?
Yes. So we are given one course in undergrad in sign language, which isn't enough. And now more and more are becoming profoundly deaf and using like Coblin. So yes, it's a lot to become fluent. You know, I mean, it's 2 years full-time at the tech. But I do wish that, yes, you know, that I had more people for education for that.
So would you say the rate is of failure where you just can't help an individual? Is there the points where you just can't do anything? Let's say someone my age, 26, that has hearing loss, and it just, no matter what you try, it just doesn't work? Is there a situation like that, or is there always a chance for you to get that?
There should be always a chance. If your hearing gets so bad that even with hearing aids, you can't understand them, or you know, you're severe to profound, then we would look at cochlear implants. And I just had, at the training last week, we had a recipient that she was doing phenomenal. She went from like 5% understanding of speech now to 84%. So like the success rate and what they can do with that technology too is huge. So, but now not everybody's a surgical candidate. Not everybody will be like, yeah, let's open up my head and like put something in there. But when you get to that point, there's, you know, sometimes they fail. And then at that point, I know, like, yeah, then there's nothing I can do. But I've worked with a kiddo that was born with like no ears on either side. And he went out, luckily parents were physicians so that they could afford it, but actually went to a place in California and had his ears completely reconstructed with like human tissue. So you would have no idea that he really had no ears. And then he wore like those bahas. So he had the inner ear, the hearing organ, but he didn't have the ear canal or the outer part when he was born. So when he was 7, he went and had that complete reconstruction. So it's really cool. I had no idea. The speech, or not the speech, the school audiologist I was working with was like, hey, those are completely fake. But it was real skin tissue. It was cool. So. Yeah, isn't it? Yeah, it's pretty neat. Anybody know somebody with hearing loss?
I
Parents,
know, like,
grandparents?
there's like 50 of them right here sometimes, you know, they don't hear you.
Oh boy, now. Selective hearing, we can't do so much about, but. And hearing aids when he was alive were not nearly, I mean, I'm sure he probably still has. Okay.
So what's a typical, let's say, hearing, what's the typical cost? Rough idea.
Starting out for a pair of hearing aids is about $4,000. And that's for 2. But depending on where you go, you know, some people they are going to rate this amount like 10 grand. That's way too much. But typically for a pair, they start out about $4,000.
Lifetime?
Lifetime.
What do they last? How long do they last? Are they replacing those? or-
Yep, about 5 to 7 years. But now I have a patient on my caseload, her hearing aids are 15 years old. I think I'm finally getting her convinced to invest in a new pair because my computer no longer recognizes them. They're so old. But yeah, you know, 5 to 7 about. And really you're wearing a mini computer on the back of your head. You know, I think lifespan will get to be a little bit more now with the rechargeable. Because with the lithium ion, you're not opening a battery door anymore, and that's where a lot of the corrosion and a lot of the stuff kind of happens. So I think hopefully they'll last longer. There's lots of places to get hearing aids. You know, you can do an ENT practice, which is a great place to get one because they're not a bread and butter. Like we don't have to sell you hearing aids to keep our lights on and pay our employees versus like a private practice. You know, so we have a little bit different mindset as far as our patient care. You know, but unfortunately, there's internet, there's catalog, but if it sounds too good to be true, it is, yes.
Are any of the cost of hearing aids covered by insurance?
It's a really good question. Medicaid, yes. Most Medicaid plans will cover hearing aids and all your accessories, like your batteries and stuff, 100%. Medicare A and B, unfortunately, does not. There are a lot of Medicare supplements that are starting to offer some coverage. Unfortunately, a lot of times you have to go through third parties to do that, but there is some benefit to give patients access. And more commercial insurances are offering benefits. It's often subject to deductible. So with high deductibles, that's not the greatest, but they're coming around, slowly but surely. 3 years ago, I would have said no, fix that Medicaid. So they're getting a little better.
Not fast enough.
No, yeah, not fast enough, no. So, we wish we could give them away too, but I would lose my job, so.
You talked about job shadow. Do you want to talk about that if anybody's interested?
Yep, so our office is always welcomes students, whether you're in high school or in college, to come shadow. So if this at all interests you, like, oh, maybe, I don't know, because it's really hard on paper to know to the extent what the testing kind of is. I have business cards. My phone number and my email is on there. We have a lot of kids come, and really it's, you know, it's a good way just to see. And I encourage you to, like, whatever profession, you know, shadow. And don't just shadow one, shadow multiple, because they're going to have a different perspective. And don't be afraid to ask them questions. Like, what don't you like about your job? That's a fair question. You know, what's the downfall of the career? Because no matter what job you do, doesn't matter if you're flipping burgers in high school at McDonald's, or you're have the #1 single on the radio and you're, you know, carry underwear or whatever and living the life. There's downfall. There's paparazzi. You're criticized for every move you make. Like, now she's famous. She's got a pretty cool gig, but there's a downfall to that. So don't let anybody fool you if you go shadow them and they say, I love my job. It's wonderful. Hopefully they love their job, but there is a downfall of it. So you want to go with your eyes wide open to make sure that downfall is not going to make you go, I wish I would have known that. I never would have done this. So don't be afraid to ask those questions, because most of them are willing to just be honest. So
what made you guys decide to do the new building addition, just getting that busy?
yeah.
You needed more space, more room, more?
We need more space. Right now, we actually have 2 locations in Wausau. One right up the hill. It's basically overflow because we literally are busting through the seams, and we are continuously growing. And there's space in the new building that's not being built out, because we're willing to partner. Maybe it's with speech, maybe it's with physical therapy, maybe it's with occupational therapy or whatever, to do more in-house, like, referrals and more patient care and stuff. So. But yeah, that's why we simply were out of room.
So in the place that you have right now, do they do the surgery there too?
No,
So let's say the new place, we do surgery in the new place, we still need to go to.
we do surgery either at Aspirus, otherwise, actually, the ENT is owned by ENT physicians, the partners, and they also have our part owners in the surgery center. So that was a thought, to put surgery kind of like on the 2nd floor, but, no, which is okay. Other questions? Yeah.
I have a question for,
Yes. Okay.
where did you go for your
So I was just asked, like, where I went to undergrad. I went to the University of Minnesota. And I loved it. And then I'll be honest, I had no idea that Stevens Point was even on the map. But that's where I got into school, so that's why I'm here. And I love it. It's really been a fun program. It's challenging, but yeah.
With the joint program we're in, half the students are in Madison, half the students are in Point. So if you're like, I want to get out of this small town, I want to be in a big city, you can live in Madison. So half the professors are Madison, half the professors are Point. And so if you're being taught in a class by a Madison professor, there's huge big screens. So you can see the professor, you can see your classmates in Madison, and they can see you. So it's like virtual teaching, but you're not sitting there reading or watching lectures recorded. You're actually in live time, so you can have discussions and communicate. So it's a pretty cool system. Sometimes we travel down to Madison for some labs. They have a couple pieces of equipment, at least they did when I was in there, that we didn't have in Point. But otherwise, it's really, well, so.
I also just want to share with you guys, because like when I was in high school, I did like PSEO. Do you guys have that here? You know what that is? Okay, it's where you like go to, like I only went to school for like half the day, and then I went to the university and took college classes like during my time. And high school just like wasn't for me, and I'm sure there are some of you guys that are like, yeah, I can't wait to be done. I get that. I feel like that right now in my program. But I still love it. Anyways, I totally forgot where I was going with that, didn't I?
College classes, want to be out of school.
Oh, thank you. So, I took advantage of a lot of opportunities to like meet with professionals because I had no idea what I wanted to do, like going to college. But I didn't want to like waste my time and money of like, you know, taking classes and failing. I'm like, that's not fun. And so Dr. Sigmund is offering you guys a really amazing opportunity to let you shadow her. Okay, so even if you're like, maybe this at least gets your like feet in the door to be able to just say, I've been inside of a medical center and like, I think I like this pace. Maybe this is where I'm supposed to be. You're like, no way, I don't want to deal with patients. I got to find out something else.
Or even our ENT docs. Our ENT docs are often, and that is, you know, so otolaryngologist, so that's med school, that's residency, that's, you know, so if you want to be an MD doctor, you know, that's something that you can shadow them as well in a facility. And then you can pick their brain about what's medical school like. You know, like, and get the nitty gritty kind of that, what's the downfall of being a med doctor? Yeah, you make buku dollars. I mean, you make a ton of money, but, you know, the malpractice and the nights, the weekends, the on-call, the stress and pressures of that. Like, is that something you want to do? And if it is, awesome. We need lots of MDs, but, you know, I wish I would have known more about, like, PA. You know, they have that PA program right here that you can do right, you know, what was UWMC, you know, not any the weird Wausau Stevens Point collaboration. Yeah, but, you know, you can go right there. 2 years, well, after your undergrad, 2 years, you have your PA. You know, and then you're prescribing meds, you're able to do surgeries, you're able to do all that kind of stuff. So, you know, make sure you kind of explore those routes too, because NPs and PAs are in huge high demand. I mean, I guess now I'm promoting other fields, but hey, I wish I would have known, because I didn't, so.
And audiology isn't for everyone, okay? Like, that's why there are so many different things, but I would guess that there would maybe be 2 of you that knew, like, what this was before she told you.
So we work with a lot of people that have no idea what we do. So
That's just the way it is.
All right, you guys got just a couple minutes, just hang tight.